We serve about 8,500 clients a year, and so many of them have serious mental illness, significant substance use disorders, and without psychiatric services it would be very difficult to treat them appropriately and effectively. So with that said, we have a really robust and diverse group of psychiatric services staff. So together we have approximately 3 child and adolescent board-certified psychiatrists, a 4th one starting in July. We have 2 adult psychiatrists. We have 2 adult nurse practitioners, 1 child nurse practitioner, and then these contract services for physician time, including we have a pediatrician from New River Valley Peds who helps us out as well.
I primarily see older school age and adolescents, and I will see some adults as well. We kind of have a really nice approach in regards to family. If, say for instance, one of the doctors are seeing children and one of the parents is obviously mentally ill, needs help, then I can see them, and that gets services for the whole family. So it just works a lot better that way. It's a very nice model that we can provide for families.
And it's really, it's child psychiatry, but it's really family psychiatry because it's the entire family is involved. And so that's something next that you get to do. Instead of just seeing adults, you get to see the whole family.
Our agency is fortunate. We have multi-levels of services, and I think any combination of or independent of each other, these services overall contribute to the welfare and benefit of our community.
We really take a team approach when it comes to psychiatric services, so the physician is not just treating the client independently and on their own. They really rely heavily on the input from the case manager, the clinician, or whoever is the primary case manager involved with the client.
As a provider, we're often seen as a structured where you're here and people are here. I think our structure is more flattened. I like the collaboration. I haven't always been a medical provider, so I know what it's like to be a member of a multi-discipline team. I think that benefits our clients and our patients.
Everyone that sees me will be connected to someone else in the agent, be it just case management, a school-based clinician, an outpatient clinician. So we provide multiple layers of services to all of our kids.
So it's very true. I mean, they come to me for specific problems, but it's so far-reaching that there are a lot of parts about the child's presentation that I will, weigh in on, but I don't treat, and that comes down to what the case managers and the school-based therapist can do. So I sometimes feel like I'm in the center of the web, and I see a lot of what's going on with everyone who's treating this child, and when they're in office, we talk about all of that, not just the medication. I like the potential that the children have when they come to see me. It's nice to be able to say to the parents, even though it looks this way now, there's a lot of potential for change and improvement, and that's really nice.
You can see progress. Compliance is always an issue, particularly for the mental health population. Some of it is just based on their mental illness, and some of it is based on not having transportation, gas money, and that sort of thing. But if we can improve the compliance, we most always will see progress.
Well, the ultimate goal is wellness and increase of functioning, preventing hospitalizations. Prevention is a big part of what we do. There are other services that primarily focus on the prevention piece. I mean, we do that in our work as well.
Well, there's never enough. We have a waiting list, and we work diligently to reduce that waiting list, but there's just never enough psychiatric time. It is a significant part of our continuum, and we desperately need those services. We're also and have recently started to expand into telepsychiatry, which is helping us as well, at least right now through the Children's Crisis Grant funded by the legislators in the department. That's been hugely helpful, but there's just never enough, and we continue to strive to meet client needs.
I love what I do. I have practiced nursing in many capacities, and I'll have to say that this is probably the most rewarding aspect of my career.
I like being part of a field where we still don't know what's going on sometimes, and I tell a lot of parents, like, okay, it's 2015, these are our options, but my hope for my patients is that by the end of my career we're going to be doing things completely differently, and I think there's a lot of potential for that in child psychiatry.
I think just looking at that collaboration and that being patient or client-centered and looking at what is achievable, how do you help someone function better with where they are, it's a wonderful way to earn a paycheck. It's a wonderful way to earn a paycheck.